So I think it's important because, especially women, we tend to really worry about our breath. We can identify a problem, whether that's by mammogram or physical exam, or our partner finds something. Some lucky people can tell when their blood pressure is elevated. They get a headache.
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of a Kidney Coach, Kidney Disease Solution, and our formulas Kaigenesis. And I'm joined again today by the beautiful, amazing Dr. Ellie Campbell and her dog there in the background.
Yeah.
And Ellie is a family physician, a functional medicine doctor. And what I love about Ellie is, and if you go back and watch some of our other podcasts, you'll see her story about how she really got into functional medicine through treating one of her favorite patients, and her story of what happened with her journey, which is really amazing. But the other thing I want to say about the amazing Ellie Campbell is that she has just written a book called The Blood Pressure Blueprint, and it is all things blood pressure and how to treat it. But what is really amazing about this book, there it is, thank you, hold it up, be proud woman. It's an amazing book because think everything you know about blood pressure and just think salt and diet, not exercising, and then think, throw it out the window, you don't know anything. Dr. Campbell knows everything about blood pressure, because there are so many things that contribute to elevated blood pressure and cardiovascular disease, leading to things like chronic kidney disease and all of those sort of things that most of us aren't taught about.
I think many people were afraid to do a sleep test because they felt like the one and only treatment for sleep apnea was wearing a CPAP mask.
100% what I hear in my clinic too.
And they said, I can't do that. I won't do that. I would suffocate. I could never get used to it. I don't even go snorkeling because I can't stand that thing on my face. I would never wear a CPAP machine. I'm like, guess what? I've got a whole list of other treatments besides CPAP that can help sleep disordered breathing. They range from some of these things, right? I'll teach you. Number one, if you are a mouth breather, you're using your mouth wrong. Mouths are for eating, noses are for breathing. So if you are breathing through your mouth at night, we need to get that closed. How do you close your lips while you sleep? There's a whole variety. Some people wear chin straps. I lip tape. So I use a piece of cloth micropore tape. I cut it so it goes from underneath my nose to the middle of my chin. I fold the corners over. I leave the corners of my lip open. Some people like to put horizontal tape, but I'm a drooler. And if I collect a lot of spit in my mouth, I kind of gurgle and choke on it. So this way I can drool and wipe it off if I need to. Also, when I was a mouth breather, before I got fixed, I would get a very dry mouth at night, and this would allow me to slip a straw and take a sip of water. Once I stopped breathing all night through an open mouth and used my nose, my mouth doesn't get dry anymore. And I don't have dragon breath in the morning like I used to. So I love my lip tape. When I went on vacation to the Amazon jungle recently, and I took my lip tape with me so that I
Very
could
cool.
tape my lips closed while I sleep at night. So
Mhm.
lip taping for some people with mild sleep apnea can be dramatic. I had a patient that has been suffering from temporomandibular joint distress. He's a tooth grinder, and he's been grinding so much his enamel's worn down and his jaw muscles are sore, and he has headaches, and he woke up fatigued and sore every day. We've been seeing the craniosacral massage therapist and the TMJ dentist, and said, well, why don't you just try lip taping? So he taped his lips closed. And for the first night since he was a child, he slept straight through the night. He called me the next day and he said, angels sang to me last night. He said, it's a miracle. I had no jaw pain, I had no headache, and I woke up refreshed. When I saw
Wow.
him last week, he's been doing it now for 6 months. And he said, it's the best thing I have ever done in my life for my health is tape my lips closed. So
Wow.
who knew such a simple intervention could solve such a complex chain of symptoms? Some other tricks. There make some nasal strips that go across the bridge of your nose that simply pull the fascia just a little bit a millimeter or two up and out, making a wider nasal passage. They also make these little splints. They're little plastic things that fit up in your nostril. They sell them at every drugstore here in our community in a little starter pack with a small, medium, or large size, and you can decide which one works best for you and then repurchase when you need to at the appropriate size. So these little nasal splints can open and dilate your nose so you can breathe better through the night. Another treatment for sleep apnea that people, I have another patient that sleeps with a little stuffed animal tucked underneath her chin because that's what keeps her chin closed and keeps her lips closed. A little
Great.
stuffy. It's very sweet to think about that. I don't know how she keeps it there all night, but she claims that she does. Another treatment for sleep apnea that people are not always aware of is a mouth guard. Some people have specialty made mouth guards that pull their tongue just a little bit forward, keep it out of the roof of their mouth.
I highly recommend it to anyone with kidney disease, especially if hypertension is a driver or anyone in your family has hypertension. Again, I'll put all Dr. Campbell's details below and a link to the book. If you want to know more about what we do, head to www.kidneycoach.com. We're also on Instagram and Facebook and all those good places. Remember to hit subscribe and like. That way you get notified when I get Dr. Campbell back on to talk all things micronutrients when it comes to elevated blood pressure. Dr. Campbell, thank you again for your time. I know you've been busy and just got back from the Amazon and just celebrated a birthday not long ago. Happy birthday.
Yes, I did. Thank you so much.
Pleasure. And again, thank you for being part of our community. And we look forward to seeing you all next time. Bye.
Yes, ma'am. Bye now.